Right. Good afternoon to all of you, and welcome to the special noon meeting seminar webinar. This is a regular noon meeting that is hosted by the School of Public Health at the University of Cape Town. And this particular slot today is being hosted by the Occupational Medicine Division in the School of Public Health. My name is Professor Mohammed Jiba, and I'm the head of head of the Occupational Medicine Division. So we are very honored to have Dr. Dorothy Ngajilo, who will be presenting some of her research, specifically focusing on work-related musculoskeletal symptoms and associated ergonomic risk factors among seaweed workers in Zanzibar in Tanzania. By way of background, Dorothy is an ex graduate of the Occupational Medicine Division. Dorothy completed her M.Med in Occupational Medicine as well as her PhD at UCT in our division. And Dorothy currently works for UNEP and is based in Geneva. And as well as her previous affiliations with UCT, Dorothy is also an honorary senior lecturer in the Occupational Medicine Division at the School of Public Health. So what we're going to do now is Dorothy will do her presentation, and after she has completed her presentation, then we will allow for questions and for discussion thereafter. So I kindly urge you to keep your mics on mute while she is presenting. Over to you, Dorothy.
Thank you so much, Prof. Good afternoon, everyone, and thank you again for joining us today. And as Prof. Jibe mentioned, I'll be presenting this piece of research, which forms part of my um, doctoral dissertation on occupational exposures and health risks among Tanzanian aquaculture workers. So before we begin, I want to just acknowledge a few colleagues who worked with me on this study. So my supervisors, Professor Mohammed Jibe and Professor Shahida Adams, as well as important contributions from our collaborators from the Department of Physical Therapy at the University of Florida, who provided expert contribution on ergonomic risk assessment. So just to provide some context, I'd like first to look at the global picture. So work-related musculoskeletal disorders are not just minor aches and pains in the body. They are major occupational health challenge across the globe. And in fact, they are the leading cause of years lived with disability. And these are a very high proportion of these are linked to physically demanding work. This burden falls particularly hard on low and middle income countries because our economies are they frequently rely on physically demanding sectors. So think of agriculture, mining, and of course, aquaculture. And in this environment, severe economic risks are very prevalent, and yet they remain largely unaddressed. So as we see on this cartoon on the side, that humorously but sadly points out that for many manual workers, a pain-free back is just a childhood memory, and probably for majority of us as well. So when we narrow down our focus to aquaculture, we see that the industry is incredibly physically demanding. The daily tasks involves highly repetitive movements, heavy lifting, sustained awkward postures, among many other ergonomic risks. And as a consequence, workers frequently experience severe musculoskeletal strain, mainly on the back, the lower back, shoulders, neck, and this is what eventually leads to chronic work-related musculoskeletal disorders. And unfortunately, in low resource settings, these economic risks are heavily overlooked, which underscores the need for prevention and also coming up with practical workplace interventions. So this brings us to Zanzibar, where seaweed farming was initiated in 1989. And then it quickly grew into a cornerstone of the regional economy. Today, Zanzibar seaweed in Zanzibar is significant on the global stage, and it ranks as the third largest seaweed producer in the world. Massive portion of this harvest is exported to international market. And when you think about seaweed, it's not just a niche local plant. It is a major global commodity because once it is harvested, it is processed into everyday value-added products that we probably use on our everyday lives around the world. So extract from this type of seaweed that comes from Zanzibar um, makes a product that's called carrageenan, which is used as a thickening and a stabilizing agent for products such as toothpaste, cosmetics, pharmaceuticals, and even food stuff like ice cream. So we can see that despite this immense economic value of the product, that we have limited information regarding the occupational risks associated with this type of work on these workers. And this is the core of the study that we conducted. So to address the gap in literature, our study had three main objectives, this particular part of the study. First was to determine the actual prevalence of work-related musculoskeletal disorders among seaweed workers in Tanzania, and specifically in Zanzibar. And secondly, to identify key occupational risk factors that are driving these disorders, and also to conduct an objective postural risk assessment to highlight what are the high risk tasks in this work. So to achieve these objectives, we conducted a cross-sectional study across 3 regions of Zanzibar. We took a dual approach. First, we assessed the environmental economic hazards across 24 distinct farming sites in Zanzibar, and this was conducted at site level and not at the individual level. We'll unpack this a little bit later. And then we also conducted individual level musculoskeletal health of 602 seaweed workers. And then data collection relied on a questionnaire that captured demographic, occupational data, as well as specific work-related musculoskeletal symptoms using an internationally recognized questionnaire. This is the Nordic Musculoskeletal Questionnaire. And then to objectively measure the strain of these tasks, of the tasks that the workers conduct, we used a tool called the Rapid Entire Body Assessment, or the RIBA. So to truly understand and appreciate the physical toll of this job, we first need to look at the daily workflow of these tasks. So as you can see from this diagram on the screen, seaweed farming is a continuous labor-intensive cycle of activities. It begins in the water with building the farm support systems on the ocean bed, followed by preparing the seed stock, and the seed stock is attached to support lines. It is left in the ocean for 6 to 8 weeks to grow. Then once it has grown, it is harvested, which again requires heavy lifting work, sorry. Yeah. So which require heavy lifting. And then after that, workers transition to post-harvest activities, which includes drying, sorting, packing, and also some workers conduct processing, which includes making products such as soap, massage oil, food stuff, etc. And this is, again, it's very rigorous, physically demanding work from start to finish. So as mentioned before, to measure physical strain, we use the rapid entire body assessment tool, which evaluates the risks by looking at postures of the trunk, the neck, legs, arms, and also combines that with force or the load that's being exerted, and also looks at how repetitive the task is. And based on these elements, it generates a score from 1 to 11. So 1 to 3 indicates low risk, 4 to 7 is medium risk, and 8 to 10 is high, and anything above 11 is very high risk. So as you can imagine, this tool, the standard REBA tool, is designed for very conventional workplaces, the factory floor type of workplaces, which doesn't exactly work in the middle of the ocean. So think if you've ever tried just walking, let alone carrying heavy weight in knee-deep water or in shifting sandbank, you can understand why we had to modify this tool, because it's completely different walking on an even terrain on a hard floor versus working in shifting sand and with added resistance of water. So we had to account for unstable sand, the water depth, the incredible act of balancing and carrying seaweed on the head, which is unconventional in the lifting sense in normal factory settings. So this was done with the help of the experienced ergonomics to adjust the standard REBA tool to be able to be fit for purpose for our research. So for data analysis, we used descriptive analysis to summarize the work-related musculoskeletal symptoms, prevalence, and also their distribution. We conducted logistic regression to look at outcomes like presence of symptoms and whether those symptoms prevented work or required medical help. And we added in predictors such as work settings, experience, workload, training, and adjusted for age, gender, and BMI. And for REBA data, what we did, we just averaged the postural scores across tasks, and then those scores were converted into action level to identify the high risks activities. So now looking at the demographic and who exactly is doing this backbreaking work. So if you look at the demographic background breakdown, you'll see quickly that the women are truly the powerhouse of this industry, where we have over 90% of our participants being female with a median age of 50 years. So many of them are middle-aged. These are highly experienced workers with a medium time spent working seaweed-related work of 20 years, and majority are doing this work onshore, and only 11% are conducting processing. Again, this was not surprising because, as I said before, majority of this of the seaweed is destined for international market. So it's also important to point out that seaweed farming for these workers is not often their only labor. To sustain their livelihood, they also have to do other work such as agriculture, informal trading, weaving, fishing, crafting, masonry, etc. So it means that their bodies are subjected to physical strain across multiple demanding jobs. So looking at the health outcomes, an overwhelming 93% of the workers reported experiencing musculoskeletal symptoms in the past 12 months, and 74% had experienced symptoms just the past days prior to the survey. And if you look at the body map, you can see where this pain is concentrated, and mainly is on the lower back, which is the mostly affected area, impacting 82% of the workers in the past year and 48 in the past week alone. And this is followed by the neck, the shoulders, and also the upper back. And what is important to note that this is just not mild discomfort. Um, about 45% reported that these symptoms were severe enough to prevent them from going to work or needing, this also work needing this pain requiring medical assistance. And for people who are in the informal sector, you can just imagine if 45%, close to half of them cannot work because of the pain, how that affects their livelihood. So again, here is where data also gets a little bit interesting, because you might assume that all seaweed work takes the same toll on musculoskeletal health, but there is a massive divide. Engaging in farming tasks was shown to more than double the odds of developing work-related musculoskeletal symptoms compared to processing tasks. And this is shown by over the double the odds of this outcome. And this is because of the nature of farming, which involves heavy lifting, awkward postures in the water. And we think that this is the major driver of the risk. Ironically, when worker steps out of the water into processing tasks, for example, soap making, this was shown to be protective and reducing the odds of injury. And this is not surprising because, as we'll see later, processing tasks are much less intense as compared to farming tasks. Furthermore, time doesn't seem to be on the side of the farmers, because the longer they work, the higher the risk of developing musculoskeletal symptoms. So, and what we think we found a plausible or a possible dose-response relationship for both long-term and acute exposure. For long-term exposure, we see that each additional year of experience in the industry increased the odds of low back pain by 4%. And looking at acute daily exposure, each additional hour spent in farming per day increased the odds by 24%, and also work preventing symptoms by 21%. So now you may also be wondering whether it matters where you plant the seaweed. So the short answer is yes. And this is what we call the onshore disadvantage, because the onshore farming is associated significantly with higher odds of upper extremity pain and symptoms that are preventing work compared to offshore farming. So what is onshore farming? Is farming in the shallow waters versus farming in deep waters. And why farmers do this? Because when traditionally seaweed is farmed in the onshore waters, which are much cooler, but because of climate change, the water is becoming warmer, and that's not good for the seaweed. So farmers are moving far offshore into the deeper waters because the water is much cooler, and that's favorable for the seaweed. But this creates that difference in the risk. And what we see is actually the working offshore is also advantageous for the workers. And why is this? Because for the onshore tasks, they require much longer duration of sustained awkward postures and also intense manual carrying of load. But when they move into deeper waters, in contrast, they have to that work depends a lot on tidal schedules. And workers have to come back to the shore. Maybe they have to work maybe less hours and come to the shore much quicker. And that is protective because the hours of work are much shorter. And also they don't have to carry the load because they're using boats to transport. So that reduces the manual handling burden. Beyond seaweed farming, as I said, the other livelihood activities also compound to their risk. And we found that those who engage in informal trading had nearly double the odds of suffering from low back pain and a 65% higher chance of symptoms that prevented them from working. And this again is attributed to the physically demanding nature of informal trading, which involves prolonged standing, awkward postures, and carrying heavy loads. So that compounds the risks of the musculoskeletal symptoms. So amidst the statistics, which are quite severe, we found highly encouraging piece of data, which points towards an intervention. And here we looked at the protective, we saw protective power of occupational health and safety training. And what we saw is workers who had received occupational health training had much lower odds of experiencing symptoms, and specifically symptoms, training reduced the odds of low back pain to an odds of just 0.34, upper extremity pain is 0.35, and also symptoms preventing work. And the implication here is great because it shows that even basic awareness and education can have a protective effect on this vulnerable population. Because when we inquired about the type of training they got, it seemed like it was the primary goal of the training was to improve production, but in there they were introduced to some elements of health and safety, and even that minimal training was shown to be protective. So by applying the modified RABA analysis that I've mentioned before, we were able to isolate the most dangerous or high-risk tasks that need immediate interventions. And these were in planting, harvesting, and drying. And during planting, activities that involved standing with the trunk severely bent forward, as you can see in this picture, whether they were cleaning ropes, placing seedlings, or building support line, this posture during planting was proved to have high risk of musculoskeletal symptoms. And then harvesting, mainly all the subtasks in harvesting were high risk. So taking the seaweed from the support line, carrying it to the drying site, all that was needed, it had a high action level. And then drying, again, similar to planting, it requires repeated bending forward to sun dry seaweed on the ground, and that carried a high risk. So in conclusion, our study definitely showed that work-related musculoskeletal disorders are highly prevalent among Zanzibar's seaweed farmers, with the lower back suffering the greatest burden. These disorders are primarily driven by occupational factors and specifically poor work postures, poor sustained repeated work postures. However, the high-risk tasks we've identified, combined with the proven success of occupational safety and health and safety training, provides us with a clear evidence-based roadmap for intervention. So finally, looking into the future, our research recommends the following next steps. First, as I said, we had to modify the RIBA tool so that it is fit for the purpose of this study. However, we understand this was like this modification needs to be validated. So we think future research can look into validating the modified REBA tool so that it can be used to accurately assess postural loads in water-based work environments globally. And this is important given the fact that more and more of economy, fishing and most of the fishing is transferring into aquaculture. So assessing the musculoskeletal risk and economic risks is going to be more and more important moving forward. And the second thing is, as I said, when we did our study, when we're evaluating the tasks, we're evaluating the using the RIBA tool, we evaluated at the task level and not at the individual level. So, so this was mainly to give us an idea of which are the high risk tasks and not necessarily connecting the task to the health outcome. So we think that the future research can focus on detailed individual level posture assessment to directly link specific micro postures to the exact musculoskeletal outcomes, and that could inform interventions much better than the task level assessment that we've conducted. And then finally, the ultimate goal of this work is to inform development and implementation of real-world ergonomic interventions and workplace modifications that will tangibly reduce the risk and protect these workers from musculoskeletal disorders. So thank you so much for your time and attention, and I hand it over to Professor Jibe for questions or discussions that you may have.
Thank you very much, Dorothy, for that very interesting presentation and some very interesting findings. Well done to you, and congratulations on your PhD. So the floor is now open for questions. Do we have any questions? I see Leslie. Please go ahead, Leslie.
Hello, Dorothy, and what a fantastic presentation. Excellent research. Thank you so much. I was trying to wonder what kind of interventions could be done that are engineering designs upstream. I'm just thinking, what can we do about it? We can train people, but is there anything that could be done about changing the way people work that's, equivalent to a sort of a engineering hierarchy of control? Anyway, there might not be an answer, but I'd be interested in what you think.
Thank you, Leslie. Was there a pun on the word stream there? You said upstream. Okay. I see Yumna also has a question. We'll take Yumna's question, and then Dorothy, you can answer those. Please go ahead.
Good afternoon, everybody. Thank you, Dorothy, for that presentation. I found it very interesting. My question was, I've got two questions. One was very similar to Prof. London's about the engineering control measures that workplaces had in place. The second question is, I just wanted to understand the level of exposure of ergonomic risk. So what percentage of time would workers spend doing the actual farming tasks, which from your presentation, I can make out carry the highest ergonomic risk. So, I just wanted to know percentage-wise, what time do workers spend doing the farming work as opposed to the more protective processing work? Thank you.
Thank you, Yumna. I note your question, Itumeleng. After Dorothy answers those two, then you're welcome to ask your question as well. Thanks, Dorothy. Over to you.
Yes. There have been thoughts on the engineering controls, and mostly it's to help with lifting. And there's been, there's some local ways that I'm trying to find a picture of an example of lifting aid that workers have developed to be able to assist with lifting. I may be able to show it later. So it's like a buoy, and then they put the loads on top, and then it's easy to pull across the water. So and then once it goes to the on shore, then it can be carried with other lifting aids. So that's what the type of like upstream engineering work that has been conducted. And then for Yumna, so yeah, so it's 4 to 5 hours they spend in farming on an average, in farming and processing as well. So it's yeah, 4 to 5 hours. And that still is significant enough to cause musculoskeletal challenges.
And so Dorothy, if you have to compare it to processing, how long do the women spend during
I mean,
processing?
it's quite the same. Yeah, because it's just that when they're doing farming, I mean, yeah, it's 4 to 5 hours, and then when so what usually happens is um, the the work is depends on the tides, and so within a month, about 2 weeks, there's like low tide. So majority of them will go into the ocean, and then they'll do farming or tend to the farms or harvest, depending on when they farmed. And then the other 2 weeks is when there's high tide, so they cannot go to the farms, and they spend those 4 to 5 hours in their cooperatives where they will do processing tasks. So it will be the same, but it will just be different times of the month.
Yeah, thank you, thank you. So it's not just the time then, as you have shown, it's also the nature of the work, the tasks
Yes. Mm-hmm.
that are associated with higher ergonomic risk.
Yes.
So Itumeleng, would you like to ask your question?
Thanks, Prof, and thanks, Dorothy, for that. Of interest to me was, would you be able to describe, the kind of medical or occupational services that the workers have access to? Just looking at the high prevalence of musculoskeletal disorders, where do they access care? And do they get time, or where do they get time to access medical care as well? Thanks.
Yeah. Yeah. That's another challenge. Maybe I didn't show in this slide. Yeah. So I mean, as you can imagine, there's no occupational health service for the farmers. But I mean, also just access to healthcare is also a big challenge. Just general, not even speaking about occupational health and safety, because I think we only like 1% have health insurance, for instance. And yeah, they do have access. I mean, in terms of they can go to the hospital. I think for most of them, there is a hospital within 1 kilometer radius of where they work or live. But there's they don't have access, and we think maybe that's where because it's heavily reliant on primary health care. So if part of the interventions for other part of the study, because we also looked at respiratory issues and skin disorders, we think training the local health workers to be able to identify and probably refer to appropriate um, levels of care could be helpful. So yeah, so the answer, the short answer is this: they don't have it, but there is opportunity to train local healthcare, because they do have within 1 kilometer health facilities.
Okay, thanks. I see Kanis. Would you like to ask your question directly to Dorothy?
Yeah, I mean, this is really an interesting talk because I haven't ever thought about the seaweed industry. So I was just wondering, how formalized is the seaweed
harvesting sector in the context that you did your research, because like to what extent the workers would be covered by your occupational health standards and protections. I think it maybe also links to Itumiling's question.
Yes, yes. So I mean, so I would say it's again it is informal, but there is a little bit of level of formalization, and that brings away the I mean how an entry point for intervention, because most of these workers work in cooperatives. So they work together in groups of up to 15 women, and most of these these groupings are for social purposes, and also they are for to increase their bargaining power, because like I said, majority of this seaweed is destined for international market. So there is a middleman who buys the product from the women and then sells it to big companies overseas. So these women have kind of like joined together to be able to have a much stronger bargaining power against these brokers. And also when governments want to provide support, financial support or loans, they usually don't go to individuals, they go to these women who work in cooperatives. So there is opportunity to do more around, so you can reach them that way. And but in form of like providing support in terms of occupational safety and health. If there's like standards that they really they don't have access. They don't even have access to workers' compensation or the occupational safety and health legislation does not really cover informal workers. So that's also a big challenge. So they only rely on like public health um, act, which is not really, I mean, there's a mention of occupational health in the Public Health Act, but there's no mandate within the ministries of health to deal with occupational health. So that's also a big challenge. But there is opportunity to formalize them using this cooperatives. And I think because the government now is, I mean, there's opportunity in what we call the blue economy, which is now heavily reliant on the ocean and I mean, and basically water bodies. And there've been discussions on how to support these farmers because they form a big portion of the economy, particularly in Zanzibar. So this could be, these are the ideas that are being floated around. How do we formalize these workers?
Thank you. Dorothy, I see Yumna had another question. Yumna, do you want to ask your question?
Dorothy, I just wanted to know what happens to women who fall pregnant.
Yeah. Yeah, I mean, yeah, it's as probably it's like just like many other informal workplaces. There's actually nothing in terms of social protection for the workers. Yeah, so that's the big challenge when they fall pregnant or they fall sick or something happens to them, they have to rely on each other. And I guess also that's the good thing for them having these groupings, the social groupings, because then they can depend on each other. There are few who prefer to have their own farms, like portions, but majority, even if they have their own little farms, they still belong to a certain group and they pool money together and they loan each other and they assist each other in the social responsibilities. So it's very it depends on the social capital largely.
I don't see any other questions. I have a question for you, Dorothy. So, in your presentation, I think you kind of suggested that offshore um, seaweed growing and harvesting seem to be associated with lower risk, ergonomic risks, right? And the risk for
Yes.
developing musculoskeletal problems. Because of this change in the work process, have there been other risks that have now been associated with growing offshore? And what would this be? And is there any kind of change in the gendered distribution of the work as a result of this change in the work process? Thanks.
Yes, thank you, Prof. Yes, with this change, I mean, it is good for the, we see it's good for the musculoskeletal health, and it's also good for the seaweed because the water is much cooler. But then there's the challenge, the safety issue of working in the deeper waters. Majority of these women cannot swim, so there's the risk of drowning in there. And also that there's also the challenge operating a boat. That's traditionally, it's not a job for a woman. So that also brings disparity in terms of who can be able to farm in the deeper waters and access, be able to, yeah, to be, to gain, yeah, yeah, so there's that challenge as well in terms of like the safety risk, but also it creates disparity because women cannot operate boats, or if they have to do that, then they have to pay a man to go into the deeper waters to help them with the farming. So what has been happening is now there are many NGOs who are supporting women with swimming lessons so that they can be able to be safe, also that they're safe in the deeper waters. Yeah, but I guess they'll also need more financial support, and I think these are some of the things that are being discussed at the within the government with this shift to blue economy to support more women to be able to farm in the deeper waters.
Thank you. And then if there aren't any other questions, I have another one. This is a little bit more challenging. We had an interesting journal club last week, and we were talking about work-related upper limb disorders. And what emerged was the usefulness of medical surveillance in relation to early detection of, in that case, was work-related upper limb disorders. So you mentioned the REBA questionnaire. Do you have any more information with regard to the sensitivity and specificity of the REBA tool and also the Nordic questionnaire, which perhaps more what I'm talking about, the RAS questionnaire. So if we were to use such an instrument, what do you think? How well would it perform in your setting and then in other settings?
Yeah, that's a difficult one, yes. Yeah, because I mean, it will be more the Nordic questionnaire because the REBA is mostly to assess the tasks and
Yes.
whether they're high risk or not. I haven't looked into the specificity and the sensitivity of the Nordic musculoskeletal questionnaire, but it's I mean it is used. It's very widely used, even in workplaces. I've seen, not just in research, because it's like very easy. Somebody just ticks in there, and it's yeah, it's very. I mean, it's somehow I mean, I would say this is just me, not based on what I found, but it's kind of like non-specific because it says, do you have pain in the past 7 days on the wrist? So it's not very specific, I would say, but it just it does give you like an indication of the challenge, but how specific it is or sensitive to pick, um, yeah, I guess maybe not as much, but yeah, it's something that I'll probably have to go and
It'd be
read more
interesting,
about
right?
it.
Because I mean, I think
Yeah. Yeah.
work-related musculoskeletal problems are very common in all our workplaces,
Yes.
but we
Yeah.
have a very poor handle on techniques to use to optimize our medical surveillance programs with regard to that. And it's only we seem to be identifying workers at the very late stage of the development of the disease process. And so the opportunities for prevention and intervention, are lost as a result of that. And also, I meant to, well, thank you very much. I see Itumeleng has just posted some information. Itumeleng, do you wanna just tell us what you found?
I
Itumeleng?
just did a quick search,
Yeah.
and it's
Yeah.
highly sensitive, 82 to 100%, some say.
Right.
But as Dorothy said, the specificity is variable.
Yeah.
You know, could go as low as 50%.
Yes. Yeah.
Yeah.
So then my next question was, Dorothy, how frequently do you think one should do these, administer these questionnaires? Do you have any opinions with regard to that?
Yeah. I mean, again, with the I'm thinking the challenge of like how I mean, the specificity is very um I guess, because I mean, you'd need a sensitive test for screening, right? I'm just
Yeah,
thinking.
so
Yeah.
it's highly sensitive,
Yeah.
right?
For
So it's
screening.
gonna
Yeah.
pick
So it's
up
good.
the problem as in the symptoms. The question
Yeah.
is, how frequently should workplaces be doing this?
workplaces.
Because we don't
Yeah.
have other kind of instruments, like for example, for asthma or pneumoconiosis or noise-induced hearing loss, where we've got more objective kind of tools.
Yeah.
So do you have
Yeah.
any opinions on
No, I
this?
think, I mean, I would, I mean, my opinion would be maybe, I mean, because these are quite common um, things. I mean, I would say 6 monthly. I mean, because it's a very easy questionnaire to administer. I mean, the questionnaire asks in the past 12 months, have you had this? So maybe, yeah, 6 or 12 months, like that could go into the screening. I mean, the yearly medical. But yeah, I don't have very strong opinion because I mean the question is like 12 months. In the past
Yes.
12 months, have you had this?
Yeah. And then finally, do you think you spoke about validating this questionnaire for our kind of settings, for want of a
Yes.
better word, LMICs? Do you think that that this could be across different sectors, or do you think that it needs to be done uh, for specifically for aquaculture and seafood processing?
Yeah. No, I think it will be. I mean, for me, the big thing is like when. I mean, I'll just go back a little bit before I answer that. Um, because what was clear for me from the study is that most of the time when we apply the tools, the assessment tools, we do not think about when they were developed, right? I mean, what sort of conditions? So then coming to your question is what we've done is we've tailored it to the specificities of seaweed farming. But even within aquaculture, it's different. Within aquaculture, you have the seaweed farmers. Even within seaweed farming, the onshore and offshore, there's quite a bit of difference. Because even with the adjustment that we did with this, is if we're looking at the video of a worker in the offshore and the water maybe is like ankle deep. That's different from when the water is knee deep, for instance. So instead of thinking sector, my suggestion for validation would be to think about all this like factors. If somebody is submerged in water, whether they are in the seaweed farm or whether they are in the pond, is this water moving? Because it's different when it's like water is still, you're in the pond versus there's like tides and waves. So it's like to think about different scenarios and then look at how to adjust the scores, whether we're adding one or deducting a certain score based on what is needed. So yeah, I mean, it can be done by sectors, but I think by sectors it may be challenging, but I'm thinking it's like the scenarios will be much better. Like if it's submerged in water, whether there's the ground is unstable, because unstable ground can be sand or it can be on a platform in a cage aquaculture area. I mean, aquaculture farming. So if we are adjusting based on the work scenarios, then that would cater for more all the possible sectors that the tools can be used.
Okay, thanks. That's useful. And then finally, you showed that training was protective. And but when it came to describing the training, it wasn't it was pretty generic.
Yeah.
So there's another opportunity for prevention. What specific kind of training would you recommend that these co-ops could introduce, for their members, that aside from obviously the engineering controls and that, I think that's a very creative and useful, instrument. What else how would you focus this training to kind of make it more relevant based on the findings of your research? Thanks.
Yeah. I think the findings of the research, it does show there's like I mean a huge amount of the challenges with the poor postures when working. So that's one. And then there is the lifting part, which can be sorted out with engineering and all that. But also, what also is shown is the importance of resting, because with processing, it's not sort of processing magically helps with something. It gives the workers time to rest, and they're just working there. So maybe if there's a training on how they can adopt like more sustainable postures or like better postures when working, instead of like bending on a 90-degree and going up and down every minute. Maybe they can find ways. They can be trained on better postures. And then also rotating, maybe they can do a rotation or have time to rest, and also for them to think about the work that take on. That training can also go into like the work that they take on after doing seaweed farming, because that also compounds on the risk. So the lifting that also happens when they're doing informal trading, that also needs to be corrected as well.
Good. Thank you. Does anyone have any last questions before we close? I see Zaida is typing. Zaida, did you want to ask anything?
Hi, Prof. No, I didn't want to ask anything, but maybe a comment. I was just thinking about your question, and before I comment, thank you very much, Dorothy, for the lovely research you've done. You asked about the frequency of, you know, performing or conducting the Nordic questionnaire. And for me, I was thinking that that depends on the risk assessment. It depends on the task. It depends on the likelihood of exposure, so the duration and frequency of exposure based on the task, and also what expected health outcomes there are. So I think it's not necessarily the same for every work task, depending on what the likelihood and the consequence is of that hazard. Yeah. So maybe even it would be different for the farming work, those workers in farming and those in processing, the frequency could be different. Thanks.
That's a good point. Thanks. Yeah, so it depends on the outcomes of your risk assessment as well. Good. Okay. Dorothy, did you want to make any final remarks or before we close the session?
No, not really. Yeah, but I'll just copy and I'll just paste an image of an
You
example
want to
of
share the
the
image of
yes,
the
the lifting.
okay.
Yeah, this
I
is what the farmers designed for
see. Are
carrying
you
the
putting it in the chat?
in
Okay.
the chat.
There I
Yes.
see it there. Okay, Leslie, there's an example there. It is up above the stream also, as you can see above the water.
Yeah.
Okay. Thank you so much. Thank you, Dorothy, for that excellent presentation and the lovely discussion prompted by questions from the audience. So well done to you again. And we look forward to seeing your research, reading about it in the journal articles soon. So hint, hint around that one. And thank you all for coming and all the best. Go well.
Thank
Bye-bye.
you. Bye.
Bye-bye. Bye.